Ultimately, the goal of CIT is to bridge the gap between law enforcement, consumers in our community suffering with mental illness, and our mental health providers that work with us in here as well.
So CIT has always been around and it's been available for officers to attend. But if you're an officer in Hendricks County, you've had to go to outside counties to attend that training.
There was obviously a gap in training in how we were dealing with people across this country, but specifically here in Hendricks County, it was nice that Sheriff Clark took an interest and understood that gap and wanted to make a difference here in our own community.
I came across a map. I learned a little bit about CIT from NAMI, Indiana, and on that map there were a number of counties that were green, which meant they had CIT programs, and I knew that I wanted to get our county green at that time.
So CIT is extremely important, especially today.
We are responding to more and more calls for service that have something to do with mental illness. So I think the challenge for CIT in our community is building trust. I want our community to know that they can trust the police to respond if they call and they're in crisis. They want to know that they are going to be treated respectfully. They're going to be safe when we respond. We're going to be able to de-escalate the situation and then ultimately get them the help that they need. I think CIT training is very much worth the time and the effort for the officers. It's worth it for our community so that the community knows they can rely on us and we're properly trained to respond if they need help. It's important to the law enforcement officers so that they have more tools in their tool belt. And ultimately it's worth it to the person in crisis, the person that actually needs help.
CIT has many benefits. When you think about persons ending up in our jails as opposed to ending up in a medical facility where they need to be, it's a tremendous problem. In Indiana, the sheriffs run the jails, and unfortunately, we've become the de facto mental health system.
Our jails are not the appropriate place for many of our community members that end up there. And so CIT is going to help us direct them to the right place, get them the help that they need, and hopefully stop some of the recidivism that we see today. My hope is that as we continue to grow this program, that we get more officers trained, that we're just going to be able to better handle those situations as we move forward with our community. And as we work together, we're all going to win.